I'd like to ask Pete Stark, who has done a fantastic job on the health provisions, to say a few words.
Well, Mr. Chairman, there's some really dramatic improvements. The COBRA extensions, I don't think Ronald Reagan ever, when he agreed to COBRA some years back, ever thought that we would add another 7 million families who we estimate will be able to afford and qualify for COBRA. That means they'll have health care if they've been laid off, if the factory's closed. I think that's one of the major accomplishments. We're going to extend COBRA benefits to early retirees, so they have some option between 55 and 65, or if they've been 10-year employees, to have some choice, some place to go for their medical care. Health information technology is going to lead the way. It's been one of President Obama's leading requests for health reform. It's going to lead the way to information and building a database that will let us improve the quality of medical care, provide information to all physicians, all providers, and improve the quality and the choices that patients will have in the future. So I think we've done a good job, Mr. Chairman. I appreciate your work.
The bill.
For Mr. Stark, when you look at the health care provisions that are in this bill, the expanded coverage, the increase in federal share to FMAP, comparative effectiveness, where do you rank this in terms of the broader health reform debate that I imagine will keep going on this session?
Each of these parts that are Medicare, not so much COBRA, but the rest of it, will help us in any expansion. And I look at reform as seeing that every resident has insurance. This is, some of it's deferred maintenance and some of it's just improving the current system, but it's going to help. We've been trying to pass health IT for, I think, over 15 years, and I think we're finding on our way to getting it in full force and effect. It will be necessary for any meaningful reform.
Chairman, could you tell me how a patient's medical information is protected under this bill?
There are strict privacy provisions. Once the records leave either the physician or the hospital, they won't have names attached. So they'll be sanitized records, and wherever they're kept to build a database on outcomes, the only people who will be able to get them are researchers with a need to know, and they won't be able to identify individuals.
And families with COBRA. Were you talking then about, were you counting then the people, the older people, you're including the retired
We're
people?
estimating that 7 million people will take advantage of this and the subsidy.
The subsidy part. But does that reflect the fact that you expanded it to the retired?
No, that would be an addition. I mean, this is 7. I don't know. I mean,
Could you repeat this question?
How many people? We've had, what, 40 million people over the years take advantage of COBRA. At any one time, there's maybe 3 million people on it now. The average length of time is about 7 months. I think during the year while we subsidize it, people will have a little bit longer tenure. But what the other workers will do, who are early retirees, who get laid off, we don't have an estimate.